Question 211. The most important pathophysiologic factor contributing to the formation of esophageal varices is A. Decreased prothrombin formation. B. Decreased albumin formation by the liver. C. Portal hypertension. D. Increased central venous pressure. Question 211 Answer: C. Portal hypertension. Question 211 Explanation: as the liver cells become fatty and degenerate, they are no longer able to accommodate a large amount of blood necessary for homeostasis. The pressure in the liver increases and causes increased pressure in the venous system. As the portal pressure increases, fluid exudes into the abdominal cavity. This is called ascites. Question 212. Which of the following tasks should be included in the immediate postoperative management of a client who has undergone gastric resection? A. Monitoring gastric pH to detect complications. B. Assessing for bowel sounds. C. Providing nutritional support. D. Monitoring for symptoms of hemorrhage. Question 212 Answer: D. Monitoring for symptoms of hemorrhage. Question 212 Explanation: the client should be monitored closely for signs and symptoms of hemorrhage, such as bright red blood in the nasogastric tube, suction, tachycardia, or a drop in blood pressure. Gastric pH may be monitored to evaluate the need for histamine 2 receptor antagonists. Bowel sounds may not return for up to 72 hours postoperatively. Nutritional needs should be addressed soon after surgery. Question 213. A client has been diagnosed with adenocarcinoma of the stomach and is scheduled to undergo a subtotal gastrectomy, Billroth 2 procedure. During preoperative teaching, the nurse is reinforcing information about the procedure. Which of the following explanations is most accurate? A. The procedure will result in enlargement of the pyloric sphincter. B. The procedure will result in anastomosis of the gastric stump to the jejunum. C. The procedure will result in removal of the duodenum. D. The procedure will result in repositioning of the vagus nerve. Question 213 Answer: B. The procedure will result in anastomosis of the gastric stump to the jejunum. Question 213 Explanation: a Billroth 2 procedure bypasses the duodenum and connects the gastric stump directly to the jejunum. The pyloric sphincter is removed, along with some of the stomach fundus. Question 214. A client is admitted to the hospital after vomiting bright red blood and is diagnosed with a bleeding duodenal ulcer. The client develops a sudden, sharp pain in the mid-epigastric area along with a rigid, board-like abdomen. These clinical manifestations most likely indicate which of the following? An intestinal obstruction has developed. B. Additional ulcers have developed. C. The esophagus has become inflamed. D. The ulcer has perforated. Question 214 Answer: D. The ulcer has perforated. Question 214 Explanation: the body reacts to perforation of an ulcer by mobilizing the area as much as possible. This results in board-like muscle rigidity, usually with extreme pain. Perforation is a medical emergency requiring immediate surgical intervention because peritonitis develops quickly after perforation. An intestinal obstruction would not cause mild gastric pain. Esophageal inflammation or the development of additional ulcers would not cause a rigid, board-like abdomen. Question 215. The nurse is assessing a client 24 hours following a cholecystectomy. The nurse notes that the T-tube has drained 750 milliliters of green-brown drainage. Which nursing intervention is most appropriate? A. Notify the physician. B. Document the findings. C. Irrigate the T-tube. D. Clamp the T-tube. Question 215 Answer: B. Document the findings. Question 215 Explanation: following cholecystectomy, drainage from the T-tube is initially bloody and then turns to green-brown. The drainage is measured as output. The amount of expected drainage will range from 500 to 1,000 milliliters per day. The nurse would document the output. Question 216. Which of the following symptoms best describes Murphy's sign? A. Periumbilical ecchymosis exists. B. On deep palpitation and release, pain is elicited. C. On deep inspiration, Pain is elicited and breathing stops. D. Abdominal muscles are tightened in anticipation of palpation. Question 216 Answer, C. On deep inspiration, pain is elicited and breathing stops. Question 216 Explanation, Murphy's sign is elicited when the client reacts to pain and stops breathing. It's a common finding in clients with cholecystitis. Periumbilical ecchymosis, Cullen's sign, is present in peritonitis. Pain on deep palpation and release is rebound tenderness. Tightening up abdominal muscles in anticipation of palpation is guarding. Question 217. A client has been taking aluminum hydroxide 30 ml 6 times per day at home to treat his peptic ulcer. He tells the nurse that he has been unable to have a bowel movement for 3 days. Based on this information, the nurse would determine that which of the following is the most likely cause of the client's constipation? A. The client has not been including enough fiber in his diet. B. The client needs to increase his daily exercise. C. The client is experiencing a side effect of the aluminum hydroxide. D. The client has developed a gastrointestinal obstruction. Question 217 Answer, C. The client is experiencing a side effect of the aluminum hydroxide. Question 217 Explanation, it is most likely that the client is experiencing a side effect of the antacid. Antacids with aluminum salt products, such as aluminum hydroxide, form insoluble salts in the body. These precipitate and accumulate in the intestines, causing constipation. Increasing dietary fiber intake or daily exercise may be a beneficial lifestyle change for the client but is not likely to relieve constipation caused by the aluminum hydroxide. Constipation, in isolation from other symptoms, is not a sign of bowel obstruction. Question 218. Which of the following measures should the nurse focus on for the client with esophageal varices? A. Recognizing hemorrhage. B. Controlling blood pressure. C. Encouraging nutritional intake. D. Teaching the client about varices. Question 218 Answer, A. Recognizing hemorrhage. Question 218 Explanation, recognizing the rupture of esophageal varices, or hemorrhage, is the focus of nursing care because the client could succumb to this quickly. Controlling blood pressure is also important because it helps reduce the risk of variceal rupture. It is also important to teach the client what varices are and what foods he should avoid, such as spicy foods. Question 219. The client being treated for esophageal varices has a Sengstake and Blakemore tube inserted to control the bleeding. The most important assessment is for the nurse to A. Check that the hemostat is on the bedside. B. Monitor for fluids for the shift. C. Regularly assess respiratory status. D. Check that the balloon is deflated on a regular basis. Question 219 Answer, C. Regularly assess respiratory status. Question 219 Explanation, the respiratory system can become occluded if the balloon slips and moves up the esophagus, putting pressure on the trachea. This would result in respiratory distress and should be assessed frequently. Scissors should be kept at the bedside to cut the tube if distress occurs. This is a safety intervention. Question 220. The nurse would assess the client experiencing an acute episode of cholecystitis for pain that is located in the right A. upper quadrant and radiates to the left scapula and shoulder. B. upper quadrant and radiates to the right scapula and shoulder. C. lower quadrant and radiates to the umbilicus. D. lower quadrant and radiates to the back. Question 220 Answer, B. upper quadrant and radiates to the right scapula and shoulder. Question 220 Explanation, during an acute gallbladder attack, the client may complain of severe right upper quadrant pain that radiates to the right scapula and shoulder. This is governed by the pattern on dermatomes in the body.